And we're going to start tonight with how New York State is raising awareness about the risk of traumatic brain injuries for survivors of domestic and sexual violence. Now, the New York State Department of Health and the Office for the Prevention of Domestic Violence just announced new efforts to help healthcare providers ask appropriate questions when survivors are in their care so they can get the help they need. 2 on Your Side's Kelly Dudzik spoke with the executive director of one of those agencies today.
This month, the New York State Department of Health and Office for the Prevention of Domestic Violence sent a letter to healthcare providers asking them to specifically screen patients who report or are suspected survivors of domestic and sexual violence for traumatic brain injuries.
When medical professionals screen, it may have an opportunity for somebody to really come forward and say, okay, I'm having headaches. I'm experiencing memory loss. I really can't, sometimes I can't make the connections that I need to make. And those should signal a conversation, especially if it's a woman who's presenting. Is there a problem with brain injury?
Kelly Owens runs the Office for the Prevention of Domestic Violence and says women are under-screened for long-term repeated actions that can cause traumatic brain injuries, like repeatedly being hit in the face or head or being shaken by an abuser.
We often do those types of screenings when somebody has a sports injury, but when somebody comes in to an office for their annual physical, we're asking, are they safe at home? And we may be asking if they have headaches, and we have to make the connection between those types of questions being asked.
And the CDC says survivors of domestic violence are at greater risk of dying from a traumatic brain injury than those who have not had those same experiences. Owens hopes screening for this becomes the norm.
It needs to be a standard screening. Once somebody hits some thresholds, there needs to be some more investigation, just as we would do with football players. Let's put the priority on those that suffer from domestic violence as well.
Well, Kelly's here now to talk more about this. So, Kelly, do they know if domestic violence rates overall are up or down?
Well, Kelly Owens told me that since domestic violence is so underreported, there's really no way to tell. But in the first few months of the pandemic, so 3 years ago now, the state saw the number of incidents reported to the hotline and law enforcement drop. Then 2 to 3 months into the pandemic, there was a spike in the number of reports made to the hotline. She says now it's up a little, but it's kind of leveled off.
Sure, and it's such a serious problem, to see that they're taking steps to screen for head injuries, because the effects, as you reported, really could be very pervasive.
Oh, absolutely. Yeah.
Alrighty, great report. Thank you, Kelly.